Typically when I see patients that come to me for the first time, they're in a significant amount of pain. They may have or may have not been through other treatment options that haven't worked. They've been frustrated. They can't work. They can't do activities that they want to do. And they're coming to me for help, for any option that I can offer them to make them better. Shoulder resurfacing has been done for several years, and there's actually some good long-term studies done on the procedure. There's a new implant I've been using, Arthrosurface, that has a newer design. So with the Arthrosurface total shoulder resurfacing, the ball portion of the joint, the arthritis is ground down, and then a cap is applied that actually grows into the bone. Humerus or ball side is not a perfect circle. It has some variation, and the Arthrosurface takes this into account. The socket side, the center is ground down where the arthritis is, and then the plastic center part is cemented in that is very thin that takes the place of the other side of the joint. These together give you the joint surface, and the articulation allows the shoulder to move. And this hasn't theoretically shown the potential for loosening like we've seen with conventional total shoulder. This is most closely related to a patient's normal anatomy than a conventional total shoulder, and this theoretically should give them the best function and pain relief because it's minimally invasive and bone sparing. I've been getting patients and referrals from around the country and also outside of the country for these types of procedures. These patients were younger or highly active older patients with severe glenohumeral arthritis that have been told they need to wait for a shoulder replacement in the future because they're too young. It's quite gratifying when I see these patients afterwards, the amount of motion they have that they didn't have before, the activities that we're doing that they haven't been doing for months to years. I think by having these other options, it allows patients to have an opportunity to get back to their normal function and have pain relief other than having to wait a period of time to be candidates for a shoulder replacement.